हेलो सर।
हेलो मैम।
टुडेज टॉपिक सर।
Organic acid test.
सर आपने टॉपिक क्यों चूज किया?
As a pediatric occupational therapist, I am working with the different kind of special children. This organic acid test helping me to understanding the level of progress of improvement, ma'am.
सर ये टेस्ट सिर्फ चिल्ड्रंस के लिए होता है या फिर एडल्ट्स के लिए भी कर सकते हैं?
Ma'am, this test you can use for both population, children and adult, specifically for the neurological condition and mitochondrial disorder or genetic disorder and chronic GID. And also you can use for specifically in pervasive developmental disorder, in all kind of pervasive developmental disorder like autism, Asperger, Rett syndrome, child dissociative disorder and Asperger syndrome and PDD not otherwise specified.
So what is the meaning of organic acid test?
It is the comprehensive assessment of urinary metabolites. It comes under the 76 parameters. It extremely helps to understanding the human cellular activity and the neurotransmitters and yeast and bacteria and vitamins, antioxidant, etc.
So what are the primary areas of this test?
Ma'am, the primary of the test is 6 to 7 primary area of test. First one is yeast and bacteria. Second one is antioxidant and vitamins. Third one is neurotransmitter. Fourth one is inborn error metabolism. Fifth one is mitochondrial function. Sixth one is oxidative distress and deacidification.
So what are the clinical significance?
I already explained what are the primary area of test. So the significance also we can classify the 4 to 5 significance. It's majorly for the pervasive developmental disorder. The first one is yeast and bacteria and neural transmitters. One is Clostridia. One of the bacteria is specifically detecting the organic acid test. That Clostridia bacteria is helping for the neurotransmitters to regulate the chemical of dopamine and non-adrenaline. So already knows once your chemical regulation process getting affected, your children arousal level goes down and focus also get disturbance and primary cognition and metacognition and execution function also get delay. That is the first clinical significance. You can find the yeast and bacteria and the neurotransmitter of function. The second is clinical significant is um, vitamins and antioxidant. So vitamin via you can measure for B5, B6 and B12 and calcium. So and glutathione an antioxidant. Once your vitamin level it goes down, the children have the oromuscular sensitivity, oral cravings. So or some cases of pico also is there. That is the second significance. The third significance is mitochondrial function. It's like once your mitochondrial level is good, the cellular activity and energy production is work well. So your mitochondrial level is will low in cells. It definitely get disturbed in the ATP transportation, ATP production, and cellular activity. Uh, the fourth one is oxidative distress and deactivation. So naturally, deactivation and deactivative distress of deactivation is there in our body. Once oxidification is getting disturbance, like your body oxidify yourself with the various substances and get delay. So it is because of that maybe the immunity get affected, health goes down. Frequently they will get the infection, and frequently they will get the allergic issues. This is all are the clinical significance you can find in organic acid test. In yeah, ma'am.
So इस टेस्ट का प्रोसीजर है?
Ma'am, procedure wise is there is no major thing. Like you want to keep it in one thing in mind. Before going this test, in between 24 hours before, you don't want to eat any kind of organic item foods like specifically for apple, grapes and pears. I hope you can understand what is the importance of organic acid test in pervasive developmental disorder what are the clinical significances helping to understanding the pervasive developmental disorder. So kindly subscribe and share this video more. Thank you.
Thank you, sir.
Thank you.